on the updated members list that comes around every month as well. So thank you for that, Haley. Thank you very much. Thank you, Jill. Claire, have you got anything for us?
No updates from me at the moment. Just trying to get through summer. It's been a bit quieter, hasn't it, over summer? Well, meetings wise, but I've had lots of referrals from health visitors over the summer. So yeah, no new updates as such.
Thank you, Claire. Thank you very much. Mel.
Hello, sorry, Claire. Where do you work? Sorry, you probably told everyone.
So I'm the community engagement lead for 0 to 19, so it's health visiting school nurse teams. So I cover East Lancashire.
Perfect, thank you. So hi, I'm Mel. I've got 3 hats. So I work within the Burnley West Primary Care Network in the health and wellbeing team, which includes social prescribing and health and wellbeing coaching coordinators. So that's why I'm very interested in all your work. But I'm currently seconded out to Together an Active Future, which is a Sport England project, which I'm sure most of you have heard of. And I'm working in the active environment group.
I can't hear what you're saying at all.
It's
Is it
really
just my
difficult.
laptop? It's very garbled.
Is it?
Yeah.
Completely. I haven't followed anything, and I apologise.
No, it's fine. My settings.
It sounds like you're underwater, Mel.
I was.
You've muted yourself now.
That's it. I think I'll just go back underwater. I'll message who I am in the chat.
Sounds better, actually.
Thank you.
Thanks, Mel. Thank you very much. So we'll leave Mel underwater and move on to Paula.
Hello. May well not sound great either, because as I say, I'm in the attic, so the signal's a bit poor. So I'm Paula Ralph from New Era Northwest. I am a Families and Communities project worker, so we do all sorts in and around Burnley and beyond. So our update really, I mean, we've had half over the summer, as I said the other day in the Pendle meeting, for those of you that do both. So it's been a little bit quiet, but we're back out and about. We've got a couple of new drop-in groups that we're going to be doing. So we are at downtown every Wednesday 10 till 12, and here at New Era Friday 10 till 12, and that's for individuals to drop in.
And as she said that, a signal dropped out.
Have I gone? I thought right. So we do the digital skills and family money matters, both very, very basic levels. So if anybody needs support around basic digital skills, apps, how to get your apps on your phone and things, how to create CVs and upload CVs, looking on job search websites, that all falls under the digital skills. And then the budgeting, again, very basic, how to manage your money, how to manage your spending, income versus outgoings, what's your essential and non-essential spend. So they're both drop-in sessions that people can come along to. I've just set up, I don't know if Tracy is aware, I will be at Ghana on the first Friday and the last Wednesday of the month. I'm going to go along whilst they have their breakfasty clubs, breakfast and lunch. Again, just to do a drop in, have a chat with people, see how it goes, see whether there's anything I can help with. And Padium Hub, I'm just in the process of setting that up to just go once a month there. Again, it'll be a Wednesday when they've got things already on, so there's people there. The emotional health and wellbeing practitioners have been doing their great work throughout the summer at community venues, but we'll be back in schools from next week, so it will go really busy for them from next week. And they have gone over to a new contract, so the numbers that we'll be supporting are massive. If anybody needs to refer in, everything is on our website. If you need support with young people, counselling, adult counselling, anything at all, the website is absolutely great, and all referrals can be made by self-referrals, parents or professionals. we're just busy. So anything that you think will be helpful for us to come along to, it does tend to be me. I'm slightly more available than the other two colleagues I work with. They're both part-time. So yeah, that is me. Thank you.
Paula, I didn't know that you would be joining us at Ghana once a month. That'd be great. That'd be really good.
Yes.
Because
So,
there are quite a lot of people that come into there that, you know, could do with a chat and maybe
Yeah.
need some help.
I know from when I was doing the telephone befriending, one of my colleagues who I used to work with many moons ago when I worked for Pettis, she comes in and does some housing work, Jess. And when I've been speaking to Sue, she said people find that really helpful of just being there just once a month. So I thought, great, we'll go along the same theme. Probably eat whilst I'm there because breakfast always smells amazing. So
why not? Why not?
I
It
will
would be
be
rude
there.
not to, Paula, as you're there.
Well, yeah, you've got to support them, haven't you? Keep the volunteers busy. Oh,
Fab, thank you.
Thank
For those of you that don't know, Paula used to be one of our volunteers, and I'm still not speaking to her properly because she left us for a job because she is that good. But yeah, she's very good, is Paula. Please do go and call in and meet her at one of the sessions that she's at. Thank you, Paula. Thank you very much. Sophie.
Hello, I'm Sophie. I'm service manager of Oak House, which is a mental health crisis house in Burnley. We take referrals from the home-based treatment team, IRS or people's GPs, and people stay with us for 7 days and have one-to-one or group sessions to learn coping tools to better manage their mental health. So I like to bob on these meetings to see what's in the area because we then signpost people for support once they've left ourselves.
Fab, and I can speak from it wasn't me, it was a family member that took advantage of your service, and it was absolutely brilliant for them. So thank you very much for that. And I know several others that have had support from Oak House, and it's a brilliant service. Excellent. So thank you, Sophie. Not that you needed talking up, but I just thought I'd say that.
Love it.
Ruth. Sorry, Ruth, you've muted again.
It's the first time I've heard about you, Sophie. So I was listening that it's 7 days. They stay with you for 7 days.
Yeah.
What calendar days? Straightforward.
Yes. So from the day they first come, it's 7 days. From that point, if someone decides they've completed the support plan prior, or people maybe have family plans and they want to leave early, that's no problem. 7 days is our max though. So the people would come, and it tends to be the routine of our day is we'd have a morning meeting and check in with everybody. People have 1 to 2 sessions a day that they've selected themselves, can be suicide prevention, low mood, social isolation. Got quite a variety, and we're doing evening relax about
Is that 1-to-1?
Mainly 1-to-1. Sometimes we do groups depending on staffing, but they are mainly 1-to-1 sessions that are about an hour, but we're very person-centered and flexible. People can come and go as they please. We might give them the sessions in the morning. They say, I'm meeting my mum for my tea, so we'll move it around.
And who delivers those?
The staff here. So we're not clinically trained, with support workers. So it's like holistic, how to manage negative thoughts.
Coping strategies.
And build routines. Yes, yeah.
Okay. Sounds really useful.
Yeah,
It is.
Yeah. On the downside, probably people can't self-refer it. Our clinical leads the home-based treatment team, so the referrals have to go through them.
Yeah.
Okay. Have I got your contact details?
I'll put it in chat.
Thank you. Sounds amazing.
It is because of the staff.
It is. Yeah, it is. It is. There should be more of them, I think. Thank you, Sophie. Thank you, Ruth. Jill, have you got anything to add to what Hayley said? I know you said you didn't, but you might have thought something.
No, just, yeah, I'm Jill and I work with Hayley and I'm the Burnley lead. We're going to be the Burnley lead for primary mental health team. So I'll be probably attending these meetings in replace of Hayley moving forward.
Hayley, are we going to lose you? We can't lose you.
I'll still be around and still coming along. I couldn't not come along to these all the time. So yeah, definitely I'll be seeing you.
See, Hayley knows it's a party once a month. Thank you very much. Thank you, Jill. Thank you, everyone. I know it's going to be a relatively quick meeting today, I think, because there's so few of us, probably due to school holidays and one thing and another, and people are busy and things. I'll just give you a little bit of an update from CVS. For those of you that don't know me, I don't think there is anybody on here that doesn't know me, apart from Jill, maybe. I'm the operations manager here at Burnley Pendle Rosendale Council for Voluntary Service. My job entails different things on different days. I can do anything. I do anything and everything, to be perfectly honest, from funding bids to managing staff, cleaning windows, vacuum floors, whatever they need me to do. Lisa's nodding because she knows. What we've got coming up is our AGM, which sounds really boring because AGMs are generally very boring, but ours aren't. And this one in particular, because I'm leading the team that's organising it, it is going to be about LGR, local government reorganisation, which also sounds boring. It won't be, trust me. Please do book your place. Once the invitations come out, please do book your place. It's on the 25th of November, and this year it'll be held in Pendle. It'll be in Nelson. So please do. You're welcome to come along. It's not a long drawn out thing. It's only for a couple of hours. The half-hour boring bit, which is all the legalities, will be done at first. You'll get the nice refreshments there. So please do come along if you can. The other thing that I've got going on just at the moment, it seems to have fallen to me, is Good Causes Conversations. Now, some of you, this is just for voluntary community and faith groups. Some of you will have had the email. I think, Paula, you might have had the email, or somebody in Graham might have had it, to invite voluntary community and faith groups to come and talk to Just Ideas, who are contracted by the National Lottery, about, and it's something that CVS have been doing for easily 12 months, 2 years, which is about, it's the buzzwords, co-design, co-production, collaboration, and it's about putting the power of funding decisions back into the hands of the community. Now, CVS have been doing this for quite some time, and our funding panel members, one of which is sat on this session today, Ruth. Ruth's been one of our funding panel members, and they are made up from community organisations rather than your usual suspects, statutory and public bodies, councillors, they always make all the decisions, and we always think communities know their own communities best, and they know what's needed in the community. So there's, if you wanted to get involved in that, if anybody from the voluntary community and faith sector wants to get involved in that, please do give me a shout. And we can add you to the funding panel. The other thing that we do is a working group called Community Influencers, and what they do is look at as CVS, our processes, and give us some pointers, tell us off, ask us to do different things, point out what the barriers are to people. We've done the applications for funding, so we've altered some of the ways and given people some additional ways of applying if they wanted to. Nobody's done it yet, but the options are there if they want it. So that's the kind of thing that will be discussed on the 9th of September at Ghana Community Centre. So if you can make it, it'd be brilliant if you could, or please pass on that information to any voluntary community and faith groups that you've got in your vicinity. The other thing that we are introducing in September, which is only next week, it'll be Christmas before we know it, won't it, is a training suite primarily for volunteers and volunteer involving groups. So the baseline is there will be sessions on introduction to volunteering. So anybody who thinks they would like to volunteer can come along, join in, and have that introduction, and then decide if they want to be a volunteer. They don't have to sign up to anything. And then after that there's a suite, so there'll be safeguard, your usual stuff, safeguarding, GDPR, prevent, suicide prevention, that kind of thing that we have as mandatory. And then there'll be things that they can choose from. So there might be things like coping mechanisms. There might be things around anxiety, building confidence, that kind of thing. So so there's a whole suite that our Rebecca Nolan, our development team training coordinator, she has put together this wonderful training suite. So please do take a look on our website at that. Helping Hands lottery. I know some people, you know, it's gambling and people just don't want to know. That's absolutely fine. However, it is raising quite a lot of money for some of our groups that are signed up. Ruth, is New Neighbours Together signed up yet for Helping Hands?
We looked at it and it just got lost in the general.
Yeah. I would say sign up if you can. Get Sharif to sign up, because there is a group, I think it's Rosendale based. They are making a lot of money because they've got families of their young people that are out, they're selling the lottery tickets. So it's like ripples in a pond. They're making quite a lot of money. So so it can be advantageous to small groups to sign up and register and just put it out there. You know, even if you only make 250 quid, 250 quid you didn't have.
Who do we contact then?
If you get in touch with Sean, who happens to be on holiday at the
moment.
Yeah,
I know Sean. Well, so Sharif actually. So there you go.
Yeah. So when they come back off holiday, if you get in touch with Sean, he'll sort you out. Okay.
Every little crumb is welcome.
It is, isn't it? Every little helps, as they say.
Yeah.
So so that's all that I've got in my head at the moment. It's the only things that I could remember to talk to you about. So what I usually do is ask if there's any emerging themes that anybody's coming across from their participants, beneficiaries, or people that they speak to. Lisa.
Sorry, there was one thing that BPR CVS and LA CVS have been asked to do together, which has only just started, which is probably why Tracy hasn't had a memo, which is we've been working with the ICB and Asthma UK to look for small community groups or any bunch of people who might have lung issues. So it might be you've got a community group somewhere and 4 or 5 of the people there have asthma. They might have any sort of lung issue going on or breathing issue. And this, I think, comes off the back of COVID and a lot of people developing more lung issues. And it's about healthy breathing. So we're not sure how it's going to look yet. We just need somebody to work with. We need a group of people to work with to work out how this could be rolled out around Burnley, Pendle and Rosendale, so that somebody there could be trained. So at the beginning of the session, they might just do some breathing exercises, which, as we know, well, me and Tracy know, are really good, not just for breathing, but actually for your well-being and your mental health. We drive everyone crazy at BPR, don't we, Trace?
Yeah.
It's like me and you going, yes, we're going to do some breathing exercises. But it's just that idea that if we have a group of people who might have some lung issues, we can get somebody trained up, then we can monitor it and test it. But it's finding that group of people, it doesn't have to be a lot of you, who are just willing to kind of be guinea pigs, I suppose. So if any of you know of a group of people, and it might just be it's a group of people who are just a bit older and the lungs just aren't as healthy as they used to be. But this has been done in other areas across Lancashire and it's been really successful. So rather than us just going, this is what we're going to do and tell people how we do it, we thought we'd work with the people themselves and find out how they would like it to look. So like I say, if you know of any organisations who might have a few people who struggle with lung issues, because I was going to go to the pulmonary fibrosis group, but then I thought, actually, no, that's not who we're looking for. We're looking for people who have those lower level lung issues, who just learning how to breathe properly. might help, and it might just be 2 minutes at the start of whatever session it is, that then it will just become part of their natural lives, and they can just, you know, develop it themselves. But you wouldn't believe how hard it is to find a few. I don't know where all the people with asthma are.
We've also talked about singing groups, because there will be people in those groups that do have breathing problems, but singing is very good for people with that low level asthma. It opens up your lungs, and that's why we sing every day, don't we, Lisa? Mel.
We do.
Mel.
I'm not sure you can hear me, so I'll type.
Okay, Mel's going to type. So, while Mel's typing, Ruth.
Yes,
I'm
absolutely,
just going back to when I was looking at funding bids, and there was a luncheon club in one of your areas. I don't know how it went, but they were attracting people. It's in, you know, I think it was in the Rose Grove area. Have you thought of them? They had a large attendance, and I would think they would be slightly older people, 50s upwards, wasn't it?
Right.
Do you remember it? I remember it. They were going to give them lunch and have some entertainment and things afterwards.
Yeah. Is it Greenbrook Methodist Church?
No, I think it was going to be based at the Railway Club.
Oh, yeah. Yeah, I do remember.
So I just think that there were maybe quite a lot of people in that age group. There's a lot of people in that area with lung conditions, I would say, you know, like low level, bothersome things. And it's an older age group. I mean, what about groups like that?
Yeah,
people
get
that
in touch with Michael. That's a really good call.
I mean, that just occurred to me. I don't know the group at all.
There is, and Lisa, take a look at our funded groups, because there might be some in there. Yeah,
we started there. But like I say, we've got in touch with people and like, no, there really isn't. And I don't know if it's because people are not realizing that this is actually good even if you don't have lung issues.
Yeah.
You know, it's good to breathe, keeps us alive. So that's why we've kind of changed our approach, because we were doing that very direct approach. We went to all the singing groups, we went to we looked along the funded groups, and we really didn't get a positive outcome. So I thought, do you know what? I'm just going to ask and see if anybody knows of anyone.
Yeah, Mel's saying, you know, they could ask the active social groups, so the Active Hive, and Burnley Leisure might be able to help through the Up and Active team. Yeah, you're right, Mel.
Yeah.
They might be able to help through that. So, and health coaches, like Mel said, the health and wellbeing coaches might already have people that that they could. So I'd get in touch with them from Burnley East and West. Paula.
Just a couple of things that come to mind for me. I was supporting a gentleman through your befriending. He does he's part of a singing group that's at Burnley College on an evening, and they put a lot of performances on at the Mechanics. And they were, from what he was saying whilst I was chatting to him, he was saying they tended to be older people, so the breathing would be important to them, obviously.
We spoke to them.
Municipal choir.
Okay.
Yeah, and they were interested.
Okay, and my other immediate thought, saying that I will be going to Ghana on Friday, a lot of that group that go for breakfast are the ex-veterans, so I don't know again whether they may potentially have some issues, and they're sat round having breakfast. You might be able to collar them.
Yeah.
Just a suggestion.
Yeah, good idea, Paula.
Yeah. Great. Thank you, everyone. I knew if I came on here and asked, people would go, oh, there's this and there's that. Yeah,
Mel's coming up with all sorts in chat. It's a shame that she's snorkeling at the moment.
I know.
So yeah, I mean, I think the best bet is to ask on forums like this where people can point you in the right direction, Lisa. Yes, it had slipped my mind. I haven't had that memo yet. I have been told about it, but nothing concrete. So it's kind of gone to the bottom of my list. I do apologise. Thank you.
No, that's all right. That's okie dokie.
Thank you very much. Well, I think I'm done. Unless anybody has anything else burning that they want to say. I usually do talk about reading at this point. But I bet you're all sick of me asking what you read. What are you reading? Nothing, Tracy. Shut up. So I'm still reading Barbara Streisand's autobiography, just in case anyone's interested. Mandy sent me a lovely email how she's rediscovered reading. That's really good, because I'm part of the reading. Paula, help me out. What's it called? Literacy Champions.
Lead Literacy Champions.
Yeah. Lead Literacy Champions. So if anybody, I would like everybody to be encouraged to read, even if it's just the back of a cornflakes packet. Just read for pleasure, not for work. So no funding bids, no assessments, no cases, nothing. Just read something for pleasure. So yeah, please do. And I'll ask you next time what you're reading. Paula.
We have, as Lead Literacy Champions, the last Friday of the month, we run a reading group here. So it's 10:30 till 12. Anybody can come along. Amy, who's the Lead Literacy Champion, that's not easy to say, is it? She has a massive list of books. They choose the books, she collects them from the library. You get them for the month to read and feedback. But we've also been given loads of books as well, which we're sort of donating out. We gave some to the half children that haven't got access to them. We've got children's and adults books. So again, maybe Sophie, if you've got people that are coming in and you think some books to take away, you could always link in with Amy at New Era and see what she's got, because they are to get out and about into the community. But yeah, definitely feel free to promote the book club. Last Friday of the month, 10:30 till 12. And as I say, we've loads of books here, and I think we're due another delivery.
We've lost her again. She's in mid-sentence.
No, you're losing
back.
me.
Here she is.
I'll put our email addresses in there, but Amy's excellent, and if anybody else wants to become a literacy champion, you can sign up to do that as well. It's not a massive thing, but it just keeps you in the loop.
It's not a massive thing. I do it, and I talk on this all the time. It is just covering Burnley at the moment, so I don't talk about it in Pendle. I do mention reading in Pendle just because I'm a reader. Claire.
I just wanted to share that I've recently been very addicted to the Freedom McFadden books. I'm working my way through the list, and they keep coming on offer for £3 each on Amazon, and they're great.
They're on Amazon, Claire. They're in Amazon, but they're also, if you go into the works, they do them every so often, and they're on 3 for £7 in the works. But you have to remember what you've already bought, because I bought 3 that I've got. Yeah, and I've to take them all back.
I think that's where I got my first one from, the works. It might, yeah. So yeah, I've just I started with a housemaid and progressed from there, and I'm just ticking them all off my list as I go through. And then as soon as I've finished, my mum keeps texting me saying, "Have we got any more of them books?"
Yeah, mine are currently going round the office at the minute, so I've read all the Housemaids and various others, but they're all really good.
Yeah, they've all got such a super twist at the end.
Fabulous. Lisa.
Yeah, I'm going to be going into Ghana Community Centre next week and using their little bookshare. And I'm going to bring 12 books, and I'm going to take 10, I think. So I'm at least can say that I'm decluttering a bit. But I've got to say, I've noticed everywhere, so many places just doing a book share, and it's so great that you can just go. And I'm trying to get ones from one and take them to another and swap them around a bit now. But isn't it good that we just have that as a facility?
Yeah. I think this is about leading by example as well, because kids today, they don't read for pleasure, because they're kind of scrolling, and the only thing that they do read is schoolwork stuff. So I think reading for pleasure, I know we were actively encouraged as children to read all the time. In fact, my brother were a bit jealous. My brother's younger than me, and he was a bit jealous of me because I got a comic every week. And I remember my mum saying to him, and he still remembers this and resents it, "You can have one when you learn to read like Tracy has done." So it encouraged him to read because he wanted a comic every week as well. So, you know, I mean, that was back in the 70s. I mean, kids are far more sophisticated now. You couldn't brab and wear a comic if you tried. But I do think it's about us adults leading by example and showing children that you can entertain yourself, because it does so much for you just reading, doesn't it? You know, it increases your vocabulary, your literacy, your grammar, you know, the way you think about things, and it can be really interesting. So not only novels, I'm with you, Claire, I like a good series. I'm working my way through the Rebus series at the moment. There's thousands of them, but they're all really good as well. And I've read all the Anne Rice series. I do like a good series, but also, you know, there's the books that teach you something as well. You know, I've read books on psychology and counselling and things, and yeah, it might not seem like it's entertainment, but for me, that's reading for pleasure. You know, I'm interested in that kind of stuff. So, you know, somebody might sit and read a manual for a Nissan Micra because that's what gives them pleasure. Though why you'd read one on a Nissan Micra, I don't know, but people do. So thank you for that, everybody. Thank you very much. So what I will just ask you to do is, I'm going to go around the screen again. I'll go the opposite way this time, Ruth. And I'm going to ask you to give me one word on how you felt about this meeting today. So just one word. So Jill, I'm going to come to you first.
Yeah, I'm going to say interesting, because I've not been before, so it's nice to hear what's going on in the community and find out things that I didn't know about what's going on. So thank you for that.
Fab, thank you. And you can say the same word. I'm just letting everybody else know. If you want to say the same word, you can. But I'm going to come to Sophie next.
Informed, because I always leave with something else to add to our little pile of signposting.
Fab, thank you. Paula.
Engaging. So I think we're quite a nice group, and we get to have a bit of a giggle as well. So it's good that we're all engaging well with it.
We do. Thank you, Paula. Mel, just shout it at us from underwater.
Fun.
Thank you. Claire.
Positive.
Well, thank you. Haley.
Beneficial.
Okay. Thank you. Ruth.
Enthused. It's been so positive to see the stuff that's going on. And it all sounds, I can imagine people saying it's low level, but for me, this is who Burnley is. Yeah. We are a community of lovely, caring, neighbourly people, and it makes me feel optimistic for the future.
You see, this is how Ruth gets you to do stuff. This is how she does it. Thank you, Ruth. Lisa.
Loved. I feel so loved that you've helped me out today. So thank you.
Thank you very much. And I'll add one, proud. I'm proud of us all. We're all doing a really difficult job under really difficult circumstances. And I think, but we just keep going and we keep smiling. And you know, we've got Mel snorkeling, we've got Paula doing her engagement stuff, we've got Ruth getting everybody to do everything. It's just brilliant. It's really good. So thank you, everybody. We are now 10 minutes early. You have now got 10 minutes where everybody thinks you're in this meeting. You can sit there and do nothing, stare out of the window. You could go out for a walk. You can go and eat chocolate in a darkened room if you wanted to. Go and scream at the world if you want to. But you can do what you want for the next 10 minutes because nobody knows and we are not going to tell anybody. So thank you, everybody. Thank you so much for coming along today. It's been an absolute pleasure once again, and I'll see you next month. Take care.
Thank you.
Thank you. Bye.
See you, thanks.